Hello everyone, now let us discuss about skeletal muscle relaxants, focusing on their introduction and classification in a clear and structured way. Skeletal muscle relaxants are drugs that reduce muscle tone and cause relaxation of skeletal muscles, and they are mainly used in conditions associated with muscle spasm, spasticity, or during surgical procedures requiring muscle paralysis. These drugs do not act directly on the muscle fiber in most cases, but instead act at different levels such as the central nervous system, neuromuscular junction, or directly on the muscle itself. Based on their site and mechanism of action, skeletal muscle relaxants are broadly classified into three major groups. First are the centrally acting muscle relaxants, which act within the brain or spinal cord to reduce muscle spasm. Important examples include baclofen, which acts on GABA B receptors, diazepam, which enhances GABA A activity, tizanidine, an alpha 2 agonist, and cyclobenzaprine, which reduces tonic somatic motor activity. These drugs are commonly used in conditions like multiple sclerosis, spinal cord injury, and acute musculoskeletal pain. The second group includes neuromuscular blocking agents, which act peripherally at the neuromuscular junction and are primarily used during anesthesia to produce muscle paralysis. These are further divided into non-depolarizing blockers such as vecuronium, and atracurium, which competitively block nicotinic receptors, and depolarizing blockers like succinylcholine, which cause persistent depolarization of the muscle end plate. The third group consists of direct-acting muscle relaxants, with dantrolene being the most important example. It acts directly on skeletal muscle by inhibiting calcium release from the sarcoplasmic reticulum, making it particularly useful in conditions like malignant hyperthermia and severe spasticity. Thus, skeletal muscle relaxants are a diverse group of drugs classified based on their site of action into centrally acting agents, neuromuscular blockers, and direct-acting drugs, each with distinct mechanisms and clinical uses, making them essential in both medical and surgical practice. Thank you.